Out of 26 million Ghana cedi budget, the Pantang Psychiatric Hospital submitted to government for the running of the facility this year, it has so far received just 330,000 cedis. Medical Director of the Pantang Psychiatric Hospital, Dr. Frank Benin, says the paltry sum is negatively impacting healthcare delivery at the facility. He was speaking at a ceremony where the hospital received electroconvulsive machines, a critical equipment for psychiatric treatment from the International Central Gospel Church.
Medical Director of the Pantang Psychiatric Hospital, Dr. Frank Benin, is displeased with the current state of the facility. One of the biggest worries is frequent shortage of medication for psychiatric patients. It is therefore common for patients to relapse after they had made progress.
So if you come to my hospital and the environment is not good, if somebody comes to hospital and they're not getting the medicines they need or the lab tests, it is because government is not providing for the money. My hospital submitted something around 26 million. So far, I hear there has been new releases. I would say 1,030,000 Ghana cedis. Even the 1 million I'm talking about, 700 has just come. So indeed, we received 330,000 so far. It's difficult. You've been to my hospital. That's how come you see the buildings that are deteriorating. That's how come you see the bad road network. That's how come you see the roofs that are leaking. That's how come you see the environment that is not very good. I mean, the food patients eat.
The Pantang Hospital has for more than 3 years been without electroconvulsive therapy machine, a critical device in the mental health care delivery. Patients are therefore transported from Pantang to the Accra Psychiatric Hospital to use the machine, but will however soon change. This is because the International Central Gospel Church has presented one ECT machine to the hospital.
Usually, it's not everything that we have. We have a lot of needs that we haven't been able to meet. And when it happens like that, it creates a huge gap in the service. So for example, when we have patients who genuinely need the service, for example, we'd have to arrange to transport them to a place who have the service. So what we're doing at this very time was we're sending them to Accra Psychiatric Hospital for them to undergo the procedure. And unfortunately, that put a lot more pressure on the Accra machine, and then it also started breaking down. So I would say that for a long time now, in the whole country, people who needed a service were not getting it. We needed to try to use other means that were not as effective as this procedure.
So for those who were not lucky to be transported to Accra Psychiatry, maybe for one challenge of vehicle or the other?
So what happens is, before they come in, then they are already unwell. So their response to treatment will be delayed, whereas this one will sort of give a quick surge for them to get well quickly. It will be delayed, and that is what and the longer it delays, the more expensive the treatment is.
The hospital, which was established in 1975, is the biggest among the 3 psychiatric hospitals in Ghana. The hospital receives psychiatric patients from all over Ghana, as well as its neighboring countries, namely Togo, Benin, Ivory Coast, and Nigeria.